Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Mr. Heineck, today you want to talk about how to treat somebody who's had a stroke and they have neglect.
Right. So if you're not familiar with this, if you have neglect.
It's a strange phenomenon.
Right. It is, and it's
a little hard to understand.
It is. So if you had a stroke on your right side, your left side.
If you had a stroke on the right side of the brain, it affects the left side.
Exactly.
Yeah.
So that means the left arm won't work, the left leg won't work so well. But with neglect, not only do the muscles not contract right, but the person literally neglects what happens on the left side.
Yeah, they don't see it. They can run into a wall on this side, not even see it.
Right.
It's really kind of a strange phenomenon, like we said.
And if you know someone that has this, you know exactly what I'm talking about. And if you don't, I'm going to show you a few things that will demonstrate that.
Yeah.
But before we go any farther, Bob.
We have some new people that have just joined us. We saw that. They just poked their head in.
Right.
If you are new to our channel, please take a second to subscribe to us. We have a subscription button here or here. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. And Brad.
Yes.
By the way, you're going to want to make sure you like us on Facebook too. Our Facebook page link is below because we're always giving away stuff. And today we've convinced the Archery Company to give away 5 acupressure mats and pillows, and here they are. This is the pillow portion, and this is the mat. These are used for treating pain, and you'll have to look at the description of it. Very well made, and like I said, we're giving away 5. You just got to sign up. There's a little, give them your email, and you'll be in the contest.
Let's carry on with the stroke.
All right, let's go on with the stroke.
Okay. So technically, there's a lot of different names for this. A common one is hemispatial neglect, and 80% of the people that have this it's on the left side. Okay, so we're gonna refer to it.
So obviously, it's a right brain thing that something's wrong with the right brain that causes neglect.
Exactly. Okay. Now Bob has a sling on, so that's a reminder that that's his involved side when we go through some of these.
This is the side that's weak. This is the side I'm having neglect on.
Exactly. So one test, I got a couple simple tests you can do to find out if someone has it, and this is really amazing if you work with someone. Can you hold that, Bob?
Sure.
Okay. So if Bob was, I said, Bob, here's a line. I want you to draw a line right down the center of it, Bob. Okay? So someone with the neglect, their mind will ignore this part. So to them, they only see this, so they're going to draw the line, the bisecting line, way off to the right.
It's an easy test for you to do on them. They're going to put it way to the right. They're going to neglect all this side.
Now, Bob, another question for this. This is the face of a clock. Can you put 1 through 12 on that face? And this is exactly what they'll do. They'll put the numbers 1 through 12 only on half of the face of the clock.
Again, they're going to ignore the whole left side.
Another thing is, like, if they're eating their plate of food, they'll eat the right half of the plate, and the left half of the plate will have food on it. They're still hungry, and they still want more food.
They'll eat the right half of the food, not the right half of the plate.
Well, if they're really hungry, they might eat the plate. No, thanks, Bob.
All right.
Yeah. Now, this is another really interesting way to test it. So I want to find out how his visual, if he has visual neglect. So you take a tennis ball or a colored ball like this, and Bob, I'm going to go on the right. I'm not going to tell him what side. I say, when can you see this ball?
Now.
Okay. Right over his peripheral vision's
I'm
good.
supposed to look forward straight.
Very good. Yep. So again, he's looking straight ahead. Can you see?
Yes.
There you go. Now,
and you might even do upper quadrant and lower quadrant.
Sure.
Because those quadrants can be different too.
Yep.
So.
And now I'm going to test the left side. Tell me when you can see it.
Now.
So, and this is exactly what will happen.
Now.
There you go. So as soon as I cross the midline right down the center.
That's when I see it.
But the interesting thing is, Bob, and you can correct me if you've had this experience, you can put the ball here and you say, can you see the ball right here?
Yeah, they can see it.
They can see it if you bring their attention to it.
It's not a visual thing, it's a neglect thing. They see things over here, but they neglect the side. It's a strange thing.
So how do we deal with this as therapists, and if you're a family member at home and you want to help this out, there's some simple things you can do. But before we go that, let's talk about the stroke and how
Itself,
this, and this is an analogy of how a stroke affects the body.
Good visual demonstration. I
Okay,
think.
so here we have a maze.
It's a nerve maze.
A nerve maze, because a stroke involves the nerve, the brain, the nervous system, and the brain is full of millions and millions of nerves and synapses, and there's so much going on. For example, if you just reach up to scratch your nose, your brain will start here, the command center we're going to call it, and it sends a signal, and to get from your brain to that muscle to contract to get your nose, it has to go through a number of pathways in the brain itself, through the cortex and through the cerebellum and down the spinal cord and around to the muscle, and finally it gets
Gray matter, white matter.
Yep, it's very complicated, but believe me, it goes to here. So since you were born and you were old enough to do that motion, your body has established pathways to do that motion.
Right.
Same with vision, same with anything you do. Now when you have a stroke, all of a sudden the brain gets damaged because of lack of blood, and we may have this. Now look what happened.
The pathway got cut off.
Right, so we no longer can do whatever that part of the brain was functioning.
Right.
But as therapists, we want to get this to either establish new pathways or heal the broken pathways.
Right. And often it's a new pathway, and that's why quite often the younger you are, the more easier it is to reestablish pathways. Your brain is what they call more plastic. It can easily more regenerate the new pathways.
Exactly. For example, my nephews, they were born premature. They're twins, born 3 months premature. One of them did have a brain bleed and had a stroke. Did not affect them at all.
Right.
They're both, you know, 6,
so
7,
young,
yeah.
they just grew right back.
You're not so fortunate when you're in 60s, 70s, and 80s.
Yeah.
The mind.
A little tougher.
Exactly.
Not impossible though.
Right.
It's tougher.
So again, as the brain heals, the maze will start to reform again, and when you ask the person to do something, to move that same motion that they did before, this has to be reestablished. It keeps bumping into walls, and it's like, we've got to get over to here to get to this old pathway and get back down to here. And this may take repetition after repetition.
And that's why repetition is so important after a stroke, because they just keep redoing things and trying to get the brain to reconnect.
And then finally, when you make that connection, then you need to work with it so it establishes and it stays there.
Right.
And this is where patience is really important when you're working with stroke rehab. And I don't, no pun on words.
Yeah. It takes a long time. It can.
So if you have someone that has
the neglect on the left side.
Right. What you can do to get that, let's say we're working with the arm. We're going to work with that left arm that's not working very well. You can take a sling and put it on the right arm, the good arm, and that's going to immobilize it. Okay? This is called constraint induced therapy. And then with Bob, I'm going to have him do some kind of activity. Bob,
And you might even put an eye patch over my good eye.
right.
Yeah.
So you're going to work the visual
Right.
as well as the musculature in the arm.
And this is assuming that you have some motion in the arm.
Exactly.
That you have
Yep.
some movement.
So, and you could put something on, things on a table, objects on a table to grab. I'm just going to have Bob, can you grab that? And it forces him. He's going to want to do it with the right arm, but we're going to constrain that
So
one.
if you can do this, a couple hours a day when they're not even in therapy, even too, that they force them to,
Yep.
again, the pathways have to be formed.
For example, brushing your teeth.
Right.
Put the sling on, let them go brush their teeth, and then they have to do it with that arm. It's a reminder. If someone's walking down the hall, it's amazing. They'll neglect and they'll keep bumping into the wall on the left side.
Right.
So continual reminder, keep going straight. And again, you can ask them, can't you see the wall that you're bumping into? And they'll look and say, yeah, it's right there. And then they'll walk and they'll bump into it again.
Yeah. Turning pages of a magazine is a real good one.
Very
to do.
good, because you got some vision involved with
Right,
it.
exactly.
Okay?
A lot of good little tips there.
TV, where you put the TV. If they're laying in bed and the TV is on the right side and we want to get that left side, the attention to go to there, move the TV over to the left side. It's one of those sneaky ways to gain that attention to that direction.
Yeah. And when you talk with this individual, you want to go to their left side.
Yeah.
You want to force them to converse with you and turn and look at you this way
Right.
all day long. Make sure, you know, the radio on this side, everything on this left side,
Right.
so that he has to, you know, find it, or she.
Because remember, those synapses are trying to find the old pathway, and if you continue to work with it, it forces the mind to work to find through that maze into the right pathway again, so you become, you know, that normal person once again, as you were.
Well, anything else you want to say, Brad? What say you?
Yeah, exactly, Bob. No, a stroke is something that, you know, it affects the whole family, but the
Yeah,
whole
it's
family,
hard.
if you understand a little bit and don't get frustrated with it, because this really can be frustrating, even for a
Yes,
therapist.
it can.
Take your time with the understanding of it. It'll help you get through and have some success. So,
All right,
take
thanks for
care.
watching.